The impact the COVID pandemic has had on the health and well-being of children and youth is well documented. But now Toronto's Board of Health is recognizing that there's a need to monitor and measure the ways we're trying to help in the future.
There were unintended consequences that cannot be ignored. The health and well-being of children and our youth in this city has taken a real hit in these last couple difficult years.
While still dealing with the immediate impact of COVID on our kids, public health officials are now looking back and realizing that the mental health and physical activity of children and youth were affected as well.
I think our kids have carried a great burden these last couple of years in terms of helping to ensure the health and safety of all of us. And I think it's time for all of us in all jurisdictions to really get laser focused on our youngest citizens.
School closures and interrupted learning have led to an increase in stress and anxiety. Emergency hospital visits for self-harm have also increased. Recent findings from an Ontario parent survey also found fewer than 1 in 10 children ages 5 to 11 and just 1 in 20 youth met recommendations for physical activity.
Unfortunately, very few Ontario children and even fewer youth met activity guidelines during the pandemic based on what we know so far. Any recovery strategy should have physical activity and play as pillars.
Toronto's Board of Health is now recommending a baseline assessment for children's mental health be established and more research be done in the wake of all that kids have had to deal with over the last couple of years.
Why this is so timely, I mean, in part, it's to have an honest conversation about what some of the unintended consequences were so that we can better address them going forward.
The last 2 years have also created a backlog in other medical fields, including immunization for other illnesses and dental screening programs in schools, something the city hopes to now address with help from the province.
Looking at those areas that matter the most and focusing our resources where we know we can have the greatest impact in terms of addressing the issues that are driving health or health inequities in the greatest way at this point in time.
At this point, it's expected that Dr. EILEEN Davila will be reaching out to the school boards in Toronto to try and develop new ways to promote health and well-being. It's also expected that she'll be back with a report before the end of the next school year. Mark McAllister, City News.